This is part 2 of the contraceptive forms and emergency contraceptive videos. We're going to be picking up right where we left off in the IUD section. So we stopped with the last video on the progestin-only IUDs. So again, there are 4 of those. They contain progestin hormone. And we're moving on to the copper IUD, which the biggest thing to know about this is that it does not contain any hormone. The copper that is composed of is what provides the contraceptive benefit, as it creates a sterile inflammatory reaction that's toxic to ova and sperm. The advantages are that it is approved for 10 years of placement, so this IUD can stay in place the longest out of any of the IUDs. So out of our 5 IUDs, it's the longest. And it has efficacy data up to 12 years. The biggest disadvantage is that it actually increases monthly blood loss by up to 35% in some portion of patients. So again, this would be considered advantageous, and then it's also on the contrary to our other IUDs, where they often decrease the amount of monthly blood loss and can cause amenorrhea, which is usually preferred. Again, to note, the serious side effect symptoms can be remembered with acronym PAINS. So all of these different side effects can be a warning sign of either the IUD system has moved out of place, so it's either been expelled or it has migrated either through the wall or in a different spot within the cervix or the uterus, which can be dangerous and increase risk of infection, not provide contraceptive benefits. And then the other symptoms are mostly related to infection. So these, again, are warning signs that if patients experience, they should be contacting their medical providers. Clinical pearls are the same as the other IUDs in that the strings will be trimmed and stay in place just outside the cervix that patients can check for on a monthly basis, and that it can also be used as emergency contraception, which we'll talk about in the end of this section. Moving on, the non-pharmacologic contraceptive methods are barrier methods and fertility awareness methods we talked about in self-care. These methods are just as a review for you. Important things to note as they were in self-care are that whether or not the method contains latex and whether or not it requires prescription. So the diaphragm and the cervical cap require a prescription. The other type of contraception to note are permanent forms of contraception. These included the Essure contraceptive implant up until the end of last year, which has been subsequently removed from the market because of significant side effects that were noted of vasectomy and tubal ligation, or having tubes tied, which is more colloquial. These permanent types of contraceptives require usually a surgery. They do not have any hormones as a result of them, but they are permanent contraceptives, so it's very hard, if at all, the patient may not be able to reverse the procedure. So a vasectomy usually requires a minor office visit, and then it requires a test of sterility 3 months post-procedure. Tubal ligation is major abdominal surgery for the female patient and requires a hospital visit and can be quite expensive. Finally, moving on to emergency contraception, we have 4 different types. In self-care, we talked about the USP method and levonorgestrel, but we'll go through all 4 of these right now. So the important things to note are the USP method is when the patient can use their own contraceptives in order to create a progestin dose that equals that of levonorgestrel. In order to figure out whether or not their combined hormonal contraceptive would equal a dose high enough to provide emergency contraceptives, patients can go to this link and check and see how many tablets they could take. Because the patient is taking so many of their tablets in order to create this progestin dose that is similar to Plan B, they're also taking a high amount of estrogen because it's a combined pill. So as a result of that, it has a high risk of nausea and vomiting. In order to mitigate that, some patients can take with food or take meclizine prophylactically with each dose. It usually requires 2 doses 12 hours apart. Levonorgestrel, as we talked about before, is a 1.5 milligram tab taken once within 3 days of unprotected intercourse. Again, this is over the counter and is available to all ages in all pharmacies. Can also be obtained as a prescription. And then the two new prescription options that we're going to discuss in our cases in class are going to be ulipristal, which is prescription only, and the brand name is Ella, and then the copper IUD. Ella is, again, one tablet. The difference between this and Plan B is that it can be used within 5 days, and it's considered more efficacious than progestin, the levonorgestrel. Because it's a prescription, it also has some risk of drug interactions, and it is a CYP3A4 substrate. It has some side effects, mostly similar to Plan B: nausea, vomiting, headache. It can have some menstrual cycle irregularities and dysmenorrhea as a result of administration, and there is an ongoing need for contraception. Similar to Plan B, all the clinical pearls, for the most part, are the same. There's ongoing need for contraception. Patients should get checked for an STI since they've had unprotected intercourse. They might have menstrual cycle irregularities and need medical follow-up. A difference between this and Plan B is that they can't restart their contraception until the end of the cycle. So they have to use a backup method for the next 14 days or until the end of their cycle, because the administration of ulipristal can interfere with other hormonal birth controls. The other thing that is different is that it can only be used once per menstrual cycle. And then it's not noted here, but one of the final things that are important to note is that it's actually considered more effective in patients that have a higher BMI. The last form of emergency contraception is the copper IUD. The copper IUD, as we talked about, can be placed within the cervix or in the uterus, and if it's administered within 5 days of unprotected intercourse, can provide the most effective form of emergency contraception of any of the different forms. Usually requires an in-office placement visit, so patients would have to go to their physician in order to have this placed. The other place that you can find information about this as emergency contraception is on UB Learns. There is a copper IUD and emergency contraception fact sheet. So it talks about how it works to prevent contraception, and there are also some links about how the copper IUD can be used. So you can look there to find a little bit more information about the copper IUD. So any of these forms can be used for a patient, and then based on a patient's characteristics, you can choose based on them which is the best for the patient. I additionally always get questions about male contraceptive forms and whether or not there are any approved. There are currently no male contraceptive forms other than barrier contraceptives that are available or approved, but I've provided some links here about several different male contraceptives that are currently in development and their different mechanisms. In class, we will go through the different cases and review some of the key points that we talked about in the videos.